off board or thrown off board rather,
Yeah.
Chichomzi will tell you something really, really cool. All right. And a person will get money and they attend village meeting.
That's so.
Or else they will throw you off board. Chichomzi, tell them more, please.
Oh, God of mercy. Jude, you are so funny. You know, what you just said now reminded me of something. One lady was telling me that if a hardship catch you, you go wise by force.
Not so.
You
That's
know,
so.
that song is an Igbo song. It's an Igbo song.
Okay.
Owusa igamati.
Okay.
When hardship hammer you, you go wise. Well. You know, my people, good morning. Good morning, Nigerians. Good morning, Lagosians. Chichomzi, your baby girl as usual. I am here. But I'm so happy. See, my voice changed.
Okay.
It's not the way it used to be. Jude, do you know why?
You're making money now?
I'm making mega money.
Oh, really?
You know, when I joined this
That's beautiful.
business, I didn't know it's going to turn out this way. I had faith from the beginning. That faith was keeping me. But something in me tells me that this is a legal business, legitimate. Why? For somebody to build a social media platform like Facebook, drop a share, you have to log into Brando shares to get the shares. You see, the thing got registered with CAC. I said, okay, let me roll and see how it will end. My brother, when I started, the first day, I said it here over the radio, that I posted things in Gather social media platform. I just took it upon myself. I said, today I'm going to post, and see that thing they're saying. I made 6,000. Now, I'm being a very busy person. I control the entire Lagos state. Everybody calls me and all that. You see, now I call 2 numbers. I now delegate duties to my PA. My student came around. I said, Mama, thank you. I withdrew money. I paid my daughter's school fees. I said, from where? Because I know that share is 6 months, generally everywhere. If you want to take away your share, it's 6 months. I said, from where? He said, Gather social media platform, of course. I made 70K. I paid the school fees. I said, Gather social, this one in my phone now that I've stopped posting since. Jude, I went back to the dashboard. I started posting. Jude, I made money. I called the CEO. I said, I don't understand what you have. This thing, is it a money minting machine? He said, you have not seen anything. Just keep referring people with your link. I went to affiliate side.
Okay.
I have made almost 5,000 just by referring. I said, what? Now, I don't need to waste my data anymore. That is what I'm saying here. Stop wasting your data on just chatting people, doing conversation, posting in Facebook where you will not make any money. Please convert that money, that time to money. Post in Gather social media platform. Yesterday we made 578 withdrawals. Remember, when I started with 180, 200 and 300 and 400 and yesterday 578. If you open Gather social media platform now, you won't see your post. As you are sending 100, don't enter. Pum. Come and see advert from different companies. It's just mind-blowing. The way this guy is going. He told me, madam, for the first time, let us do it right. He's a Nigerian. These people have been duping us, messing us up. They will bring nonsense, crap from abroad, drop it here. They will mess up us on it. Imagine Facebook, before you get monetized, you have 5,000 followers. Is it not?
5,000. It's not easy to get.
Is it easy? That is why people engage in a lot of things.
How many content you don't do before you
in a lot of nonsense. They commit a lot of atrocity. They do a lot of rubbish just to attract followers. Our CEO said, no. Come in, post. Because when you are posting, they are paying me. Let's share the money. take part of it. I take part of it. Any post you make with your data providers will pay. Yes, they will pay the host. It's not natural. That is how YouTube make their money. That is how WhatsApp make their money. Facebook, Twitter, that is how they make their money. As any amount of data they spend in your platform, you will be paid. The data company will pay you, because otherwise, if there is no platforms like this, their data will not move. Nobody will buy it. You get it now. So you see that they have been extorting us. But Nigerians, please, as anywhere you are listening to me, this is a mind-blowing business. It's not mano. It's not investment where you get returns on your investment. No. It's where you come in and be eating food on a daily basis. And it's not bring this person to bring. We don't work that hard. Oh, again, we work smart. Moving. You know the amazing thing? Jude. The God don't turn in attention to Nigeria. Don't they bless Nigeria like this? So. Do you know that our shares? I came here, I told you share was $3, right? From $6 to $3. Our share this morning is $7. Imagine people that bought last month when it was $3. They have made, if they use 10,000 to buy these shares, they have made additional 10,000 already. Do you know how much these shares will be in the next 6 months? 3 months?
To be high.
You see how people are trooping in this platform. They are discovering our assets. What about our BRC? Our digital asset. It has gone. People have made more than 1,000% just because of Gather social media platform.
Okay.
So now, what are we waiting for? Should you still depend on CBEX type? Somebody comes today, brainwash you, tell you bring 100,000 in the morning and make 500,000 in the evening. It's not possible. It's not true. Even you think it. Can you even, the business you do, physical business you do, if you put 100,000 in the morning, do you make 1 million in the evening? Let us be realistic. But these things, we can build it. They say that community is power. When we gather together, do it together, the money will come out as we want. That is what is happening in social media. As everybody come in there to do business, all the assets, all the shares, everything is jumping. I don't know what to do anymore. You know, this, I don't know what to do anymore. You know, this malam, them where they drive keke, they don't know anywhere. If they miss their direction, they can't direct you well. So always mention to the keke person, Kudirat Abiola Way is only one Kudirat Abiola Way. Alausa bus stop there. Locate yourself to Balogu. Don't move too much away from that Alausa bus stop. Our office is closed, okay? Now by 10 a.m. on Saturday, 10 a.m. on Saturday, come and be trained. I don't like people telling me I'm living far, this, can you drop the... No. Come and know where you want to put your money. If it is okay for you, please, you put your money there. If it's not okay for you, you go. Are you getting me? I'm saying it clear here. If you like what you are seeing, please do the business. If you don't like it, please, they go JJ. We don't like people telling me send the account number. Let me, I don't like it. I won't send you my account number. Come here, come to the training. Come to the training. Then if there is another training I have for people far away, I will let you know. But come for the training. 9 Balogu Street, off Kudirata. The number to say book me.
Exactly.
Yes, because you need to book. We had to go and get extra seats last Saturday. So you need to book so that if it will not favor you, in the month. 375
057 37. All right? There. Those are the numbers. Thank you so much.
You're welcome.
All right, Voice of the People, 90.3 FM. I will be right back after this short break. Stay there.
You see, when you look at the West, Europe and the US and all that, you come to find out that the leadership there are people whose values are different from what we have here. The leaders are not thinking of owning properties all over the world. Go to Dubai, buying like primitive acquisition. They will buy houses in Dubai, buy in UK, buy in the US, buy in the Caribbean. It's a cost. If you go to their houses, you see not less than 20 to 30 vehicles, and they enjoy it. They like moving in convoy of not less than 20, 30 vehicles at a time, so that they will be the people that are calling the shots. In US, if you are a governor of, let me give you an instance like California, which is the richest state in US. You as a governor, if you dare put on convoy, you will not stay more than 24 hours in that office as governor of US, of California. You cannot. I gave you an instance the other time that in 2005, I went to eat in a restaurant. The governor of Texas drove in. He came alone. I didn't even know him. It was my late friend who took me out that was telling me that this man is the governor of Texas. If it were in Nigeria, they'll drive away everybody in that restaurant. Or convoy with escort, police, DSS, military, everybody would have coded on the whole of the restaurant. Try it in America. The next day you are gone. And you may go to prison for even trying that. Who are you as a governor in the US for you to take a private jet? What they are doing here, this scam they are doing here and calling themselves governors. You dare not. If you try it, you will pay through you tell them where you're going to get the money from to go and charter a jet. You enter the commercial jet and sit like every other person. Nobody cares. Nobody will be accompanying you to the airport, clearing everywhere. People will be carrying bags. No. It's terrible. I landed in JFK 216. I was in the business class with one of the governors. He queued over there and he behaved himself. He cannot jump the queue. If he jumps the queue, he may end up not even entering US. They'll put him on the next flight and take him back to Nigeria. And there's nothing he can do. These are areas where they have sanity. These are areas that are welfare oriented. In as much as they're having hard times now because of the prevailing global economic situation. There's no madness in being in leadership or being in position of authority. They don't steal the way we are doing here. One man will own maybe 40 or 50 properties in FCT because he has entered the political position in the government. It is a terrible thing. It is worrisome and it is disturbing. I pity the upcoming generation. Is this what we are going to bequeath to them? It's very unfortunate, to say the least.
In a world where about 8 billion people are connected by click, there's a new way to get connected. Introducing the all-new VOP FM website, where talk meet innovations.
Voice of the People 90.3 FM. Yes, everyone. Let's see. I have with me in the studio Dr. Charles Adeogun. Yeah, Dr. Charles is just right here, and let's talk health. Okay, there are just some basic questions I would want to ask him, just on your behalf. Okay, yes. We are Nigerians, we are blacks. A couple of times, or often not, some persons or we as blacks don't take care of our health, the way it should be. We just overlook some of these things and just move on. So this morning, I quickly want to ask him, like I said, few questions, just very few, for you, like I said, on your behalf. Now, we want to find out some common symptoms. We want to get to understand.
The parasites, goes through a whole process that takes up to about 21 days before symptoms starts manifesting in the individual.
21 days.
So there's something called the incubation period. Incubation period is the time between when the parasite enters your body and when you start manifesting symptoms. So it's not immediately the parasite enters your body that you start showing those symptoms. And apparently the symptoms vary, because for some people they come down with a fever or chills, evening chills. They feel they are colder than usual. They need to cover themselves up. They can be shivering, and then some people have this altered taste sensation. They feel their mouth is just kind of bland. They can't taste properly, or sometimes they have a kind of bitter taste in their mouth. And some people have what we call muscular aches and pains too. That are common symptoms that people complain about. Then the headaches.
Okay.
Then of course loss of appetite would come shortly. And when you have reduced appetite, then that means that you are not getting enough calories and enough energy for your activities. So they now start becoming fatigued and weak. And because this malaria parasite infects the red cells, it causes destruction of the red cells, and ultimately you can also have anemia. So you can see that it's going progressively you get to a point where the parasite starts destroying the red cells. Depending on the parasite load in that individual, you can have marked destruction of the red cells, and the person becomes anemic. And from anemia, you can start having dizziness, fainting spells, and in some extreme cases, if the anemia is not well managed, or if the person also has underlying conditions that made them have low blood levels normally, and they now have malaria on top of that, either in pregnancy, or maybe they have sickle cell anemia, or they have other anemic conditions, then of course the anemia symptoms will be more prominent, and then you may need to take drastic steps in such people. So that tells us that if a pregnant woman has malaria, it is nothing to be toyed with. So it is something that should be treated immediately. So we have also seen from research and in community statistics that pregnant women and children under 5 are most vulnerable to malaria. So these are the demography that you don't want to joke with. And ultimately, the senior citizens, the people who are 65 years and older, also have an increased vulnerability to malaria. So that means that their outcome to malaria may not be as good as people who are younger and who have a more vibrant immune system. So if you find a pregnant woman or a child under the age of 5 or an elderly person with malaria, it's something that you shouldn't take for granted, because it can deteriorate very quickly and complications can set in quickly. So once you notice those symptoms, the first thing you need to do is not self-medicate. It is to go get yourself tested, because there are a number of things that can also mimic malaria. If you are stressed out, you can have a headache. If you are not sleeping well, you can have body aches and pains. And then you can also have loss of appetite. Once you have body aches and all of the headaches and all that, everybody just assumes.
And I don't want to mention the drug now, so it won't look like
that is why a lot of people may end up treating malaria and they still find out that the symptoms persist. So that ultimately tells them that that is not what was responsible for their fever, because fever is not a diagnosis, it's just a symptom, and it is non-specific. 1,001 things can give you a fever. If you have malaria, you can have a fever. If you have an infection, you can have a fever. A fever is just a body's response, to something going on in the body. And it's one of the protective mechanisms that the body puts up to handle infections and to take care of the body before treatment starts. So if a person starts having fever, you need to find out the cause of the fever, because the fever is not a diagnosis. You need to find out, is it malaria? That's why you need to do the malaria parasite test. Then you need to do also the full blood count to find out, if there's an infection. You check the parameters of the full blood count to know if it is an infection, possibly a bacterial infection or a viral infection. This helps the doctor to adequately diagnose with precision what the problem is and put the right treatment in place.
What about now? You spoke about, you mentioned malaria. The other one I want to mention is it glaucoma or cataract? What are the signs? What are the symptoms? Even before one goes blind, completely. What are those things we should watch out for? Because people are losing their sight every day. They don't even know why. They don't know what to do before, it gets to that stage.
Yeah, the vision is very essential, because that is the sense organ that helps us to be in touch with our environment and then be able to communicate, with what is around us. So because if you lose your sense of vision, then it's practically life is, half gone, because everything you need to do, you require your eyes for them. So to answer that question, I think the best thing is to know the family history, and people should know what they are predisposed to. These things runs in families, particularly glaucoma. So glaucoma is a vision robber. It steals away your vision, and you may not be able to diagnose it if you don't check for it in the early stages. And because it's a progressive illness, it's something that over time, before some people even find out that that is what they have, they would have lost substantial part of their vision. So glaucoma basically is raised intraocular pressure. So just like you have your blood pressure, you also have pressure, the eye pressure, the pressure in the eye.
Okay.
So most people don't know that there is a way to check your eye pressure. And once your eye pressure is elevated, because normally the eye pressure should not be more than 21 millimeters of mercury. So if you have your eye pressure very, very elevated, or it's even nearing that, you don't even want it to get to that. By the time you already see an upward trend, a continuous upward trend in your eye pressure, then you should talk to your ophthalmologist to do something about it. And that is why we keep emphasizing on the need for wellness checks, regular health checks, particularly when you know that your first degree relations have that condition. So if you have parents, sibling, or grandparents who has had glaucoma or who was blind and you don't know the cause of the blindness, you should be on your toes when it comes to your vision. So basically for glaucoma, we cannot overemphasize the need for regular eye checks, and then for checking the pressure in the eye and instituting treatment immediately the diagnosis is made. That's very key. And it's not just for you to start treatment and disappear, it's for you to start treatment and be consistent and compliant with that treatment. And be going for regular follow-ups to make sure that you are seeing improvements, in your vision, so it doesn't deteriorate. Because the truth is, it can be a progressively degenerative condition that ultimately causes visual loss. Then for cataract is basically opacity in the lens of the eye. The lens of the eye typically should be transparent, and it should normally transmit light and help with refraction of light and all that on the retina. But when the lens becomes cloudy over time, either due to age or due to diabetes or other conditions, then you have this whitish covering over the iris, and then that is so you see that whitish thing in somebody's eye. Is the opacity of the lens causes cataract. So basically the treatment is surgery, cataract removal. So a lot of people don't like to hear the word surgery because they fret when it comes to surgery and operation.
I love the fact that you mentioned surgery. See, I want to ask you, if one is completely blind because of cataract, if it goes through an operation or surgery as you call it, can the person still see?
If it's cataract and cataract alone, and the person doesn't have other things, maybe macular degeneration or glaucoma or some other coexisting eye conditions, if it's just cataract, the cloudiness or the opacity of the lens, the surgery usually restores vision remarkably.
Really?
Yes.
What about glaucoma?
Oh, glaucoma is a more difficult condition to treat, and early diagnosis and early intervention only improves the outcome. So if it is delayed and the damage is already done to the eye, the visual loss may be irreversible. So for glaucoma, time is of the essence in diagnosing it. So that's why we encourage people that so far you have a family history, even if your eyes seem fine, even if you don't seem to have a visual problem, just always include it in your regular health check, because you're already predisposed to it, because you have a genetic risk, because people close to you have the condition. Because we underestimate the power of genetics. The people that gave birth to us and the people that were directly related to whatever they suffer from, we have a higher risk of following suit in that line. So whatever they are dealing with, we should always be on the lookout and start working out preventive strategies to mitigate against that happening to us.
Someone's asking me, he said, what causes pile really? And symptoms, or how to watch out for this symptoms, or what do you, is it food that causes pile, the kind of food you eat? Okay, say maybe carbohydrate alone, or is it because of sugar? Is it because of hard meals or meat? Something. Tell us about pile. It's prevalent everywhere,
Yeah, it's commonly called pile, but clinically it is referred to as hemorrhoids, and it has to do with the vessels of the rectum, the part of the large intestine, lower part of the large intestine. And typically a lot of people who do not take enough water and who don't eat fiber-rich foods or fruits and vegetables are prone to it. And whenever it happens, you find out that there is a lot of straining because they are passing hard stool. Bowel motions are distressing, and then they have to push and strain. And ultimately, because of the high pressure in the lower bowel, you find out that they can actually rupture the fragile veins in the rectum, and then you can actually see blood. And typically you find out people saying that when they go to the toilet, to have a bowel motion, they see blood in their stool. And, it's always good to differentiate the kind of blood people see in their stool. If you are seeing fresh red blood in your stool, that means that the bleeding is from the lower part of your digestive tract. But if you are seeing dark stool, black stool, then you know that the bleeding is coming from the upper digestive system, like in the stomach or in the duodenum, like in ulcer. Yes. So you can find out that when people have peptic ulcer that is not well managed or treated and they have a perforation, they are going to have dark stool because the blood is traveling a longer distance and is digested with all sorts of enzymatic breakdown and all that ultimately discolors it and turns it black before it gets out. But if it is fresh red blood, then you know that you are bleeding somewhere lower down there, either from the rectum, or you have a colonic mass, or there is a growth, or there are polyps in the colon. Those are, or diverticulosis. All those are things that happen in the lower GI tract. But for bile in particular, a lot of people have found out that when they change their diets, they are better. When they eat more fruits, consume more fiber, take more vegetables, increase their water intake, and they sit for a lesser time when they are passing stool. You know, the process of you sitting down on the toilet bowl for a very long time also puts up pressure there and then makes the symptoms worse. So we always advise that they have a smooth bowel motion and they spend minimal time, you know, in that sitting position. You know, that helps to relieve their symptoms. Then for some of them that also have itching or pain, you know, they need to see a general surgeon to do a proper examination of that area. And for some people, they may ultimately require surgical repair or hemorrhoidectomy. That's the procedure, you know, to improve their symptoms. And you find out that some of them, because of so much of straining, you can even see some of the rectal tissue protruding out. For some of them, it goes back in spontaneously. For some of them, they may need to forcefully push it in themselves. And then for some of them, it doesn't even go in. They need to do a surgery to control the situation. So it's very important that once you are noticing those symptoms of blood in your stool, you have to make sure that you find a way of softening your stool, especially when you are passing hard stool. And you have to strain hard. Then you have to increase water intake. You need to eat more vegetables, take more fruits. And there are very good medications that help with the veins, the vein around the rectum and all that, and the circulatory aspect of the rectum that helps you, you know, to control your symptoms, you know. And then basically, of course, they may need to be on some painkillers also. But like I said, if the solution is a surgery, don't shy away from embarking on that surgery. Yes, the way to, you know, most times surgery is always the last resort when you've tried every other thing and nothing seems to work or improve the symptoms of the patient. So basically, you try your diet and lifestyle changes, and if that does not work, then ultimately you may need to prepare for surgery. But you know, because of the challenges people have with surgery, they are skeptical about the procedure. People are afraid of many things regarding surgery, anesthesia, their recovery rate or recovery process, the pain involved, and all that. So it's important to just know that if that is the best remedy for you, or what you need to have a better quality of life, then you go for it. And you have a counseling session with your doctor. Your doctor will allay all your anxieties that you have concerning the surgery, prepare you accordingly for the surgery, and let you know exactly what procedure is going to be done on you and your estimated recovery time. I think having a good conversation with the doctors regarding a procedure you're going to do has a way of calming you down and making you more receptive to doing it than you just know you're going for a surgery and you have no clue exactly what is going to be done to you. So I think having a good collaboration with doctors and communication with the doctor goes a long way in, you know, making people feel more comfortable with the idea of going for surgery, especially if that is the only option that suits them.
Bleeding in the nose is another one I want to mention. Sometimes, or just all of a sudden, you just find that your blood is gushing out of your nose. Not be say you injure. Nothing happened, but you just found out that. What do you call that? And
it's called,
why is that? Why?
It's called epistaxis, and it's a condition whereby, you know, you just notice blood comes out of the nostrils without any trauma or without any injury. So typically, it can happen for different reasons. For some people, when that happens, first and foremost, you want to see the frequency, how long has it been going on for, and then sometimes it could be normal in certain situations. Like for instance, it's normal for you to have nosebleeds if you are at a very high altitude where the pressure is very, very low, where the pressure is lower than your blood pressures. It's possible for you to have nosebleeds at a very, very high altitude. That is a possibility. But if it now happens when you are on normal level ground and you can't really tell why you're having it, some people it's because they had maybe an allergic reaction that caused them to sneeze or have nasal congestion, and they are blowing their nostrils too forcefully, they can rupture some capillaries and see blood. But in some other conditions where you don't have any identifiable factors, then you may need to investigate further. You need to check the person's blood pressure. You need to go for coagulation studies to find out whether the person has enough platelets or there's something wrong with the coagulation cascade of that individual. Then also you want to find out if the liver function test is ideal, because the liver stores important vitamins and also helps in the production of clotting factors, the things that help your blood clot. So liver function test is also relevant. And then also when people have nasal polyps, some growths in the nostrils, or something else is happening in the upper airway.
Okay.
They may have some kind of tumor or growth there. They can also have bleeding nostrils. So because of this variety of causes, it's very necessary for you to be precise on your diagnosis, and the only way to do so is to visit a doctor and run the relevant investigations. And certain times you may even need some imaging investigations done to be able to nail what the problem is. And that is why we have specialties in medicine. So you will see a specialist simply called the ENT doctor, the ear, nose and throat doctor, who will carry out a detailed examination of the nose and be able to recommend what needs to be done based on the findings. So as you can see, it's something that we can't say one cause is responsible. So thorough investigation needs to be made to be able to actually pinpoint where the problem is and to institute the right treatment.
I want to ask this question as raw as I can. I was listening to someone a few days ago, I think on social media, and the person was saying that the ears are not meant to be cleaned. I don't know if you've heard that before. That wax thing there is supposed to be left alone. Now, in fact, that is how it ought to be. And I was asking myself, wait, even those people, they bring muco from the ear, all of these greenish whatever. When some people's ears, if you know that, man, the kind of rural way they come off inside his ear is special. What's your take on the fact that some persons have said the ears are not supposed to be clean? You just leave your ears. You when you tamper with the eardrum, you have yourself. Tell us about that. Is it true?
Well, the truth is that the ear is a self-cleansing organ.
Self-cleansing?
Yes, it's a self-cleansing organ. So you don't necessarily need to put anything into your ear. And if you must understand the anatomy of the ear, what you see outside is just the pinna, this flap, this cartilaginous flap is just what you see outside. But the ear still extends inside. So you have the external ear, you have the middle ear, you have the inner ear. So the external ear, consists of this pinna you see outside. And then you also have the external meatus, external acoustic meatus, that's the canal. And if you notice, the canal is not covered with what looks like your skin. It's very tender. What lines the canal is quite tender. So that means it can be easily traumatized, it can be easily abrased. And when there is a breach in that canal, you can introduce infection in there. And also, you also understand that once you pass the canal, you're going to hit the tympanic membrane, which is the eardrum. So the eardrum is actually not so far away. It's in the middle ear. So if you examine your ear with an otoscope, which is the device we use in the hospital to look into the ear, once you pull the ear outwards and backwards and you put that light source there and you use a magnifying lens to look into the ear, the next thing you see after the canal is the eardrum. You're looking directly at the eardrum, which is like a transparent grayish membrane, And that means that if you're putting anything into your ear, you don't know how deep you've gone. And the wax that you think you're bringing out, sometimes you end up actually pushing it further in with the Q-tips or the cotton buds. And at the end of the day, you can have what is called wax impaction. So you can push it forward and poke your eardrum, which can be dangerous. So typically, when people have reduced hearing, or you feel that you're having itchy ears, what you should do is go to the hospital, have your ears checked. If the doctor says that you have wax impaction and there's so much wax clogging your ear, there are ear drops we give you that help to dissolve the wax. It helps to soften it, and once it softens it softens it for a couple of days, you're asked to return back, and you're going to do what we call an ear irrigation. So they're going to flush out your ears with warm water, warm saline, just to wash out the softened earwax, and then you'll be able to hear properly. But if you're poking anything into your ear, like we said, you can, abrase the ear canal, you can traumatize the ear canal, and you can also perforate the tympanic membrane, which would come with more ear infection, and then you can also having ear discharge. Because we see people come to the hospital, you can't even touch their ear because the ear is now inflamed, and you can also see them having discharge from the ear, meaning that they have already caused an infection in the ear. So you have a lot of fluid built up behind the eardrum, and then the eardrum has to perforate to release the pus out, and that, leaves a scar on the eardrum. So all those are absolutely unnecessary. Your earwax should actually fall off, with your
doctor. I clean my ear every morning after bathing. The next thing is to clean my ears.
It's habitual for people. People just enjoy putting something in their ear because of the sensation they get from it. It's not necessarily because the ears are dirty all the time. Some people, it's just anything they see. It's not only eardrum. They roll papers, they use toothpick, they use key, they use viral cover to all sorts of things. Anyway, I've not seen anybody put a nail in the ear, but I won't be surprised.
The way you talk about keys, go to Oshodi. Those drivers, anybody they drive from Lagos to East, they like to put key for ear.
But the same, you need to be careful because your ears are quite delicate, and even for people that swim a lot, that allow a lot of water into their ears.
Yeah.
So when you are bathing, a lot of water enters your ear, the soap and the water accumulates there. It can actually make the existing wax, swell up and completely occlude your canal, and then you can also have ear infection because water always has some kind of bacteria in it. So swimmers have what we call swimmer's itch. They can have otitis externa, and if they have, reduced immunity or they're diabetic, it can even cause worse complications with the infection spreading to affect the skull and even the brain. So it's very necessary for us to make sure that we take good care of our ears, prevent anything from entering your ear whatsoever, either water or objects. And be watchful for children too when they play, not to put foreign objects into the ear. And if that is done, they need to seek help immediately to get it out. And parents should not attempt to do that on their own because we've seen that happen. A child would drop a small bead in the ear or something would happen, and somebody at home would attempt to try to remove it and cause more harm.
With a pin or with something?
With a pin, with an object, all sorts of things. We see all sorts. So it's very important that once you see anything going wrong with your ear or you have an ear complaint.
In fact, it was recently, while I was watching that person, it was recently I noticed that, or I heard that this cotton ball is not for the ears. Voila. It's not supposed to be for the ears. They say it's for the nose rays, for you to clean some stuff from your nose and then from your eyes. What do they call it now?
They discharge from your eyes.
From your eyes, that's what is meant for, not really for.
But the truth of the matter is, any organs, you better be careful with them. Don't be too invasive. Don't be too daring. Any problems you have either with your eyes, with your nose, with your ears, please go to the doctor. We have safer methods of doing a thorough assessment and checks on those organs.
Okay. Somebody's asking a question. They said, "Good morning, in Kamijide and the doc. Please, I was diagnosed with glaucoma. I've been going from one eye clinic to another using their prescriptions, and I noticed that the cloudiness keeps on increasing daily. Now I can't even see clearly. Please, is there any means of restoration?" What would you say?
Well, to this person, I would say, I don't know where he has gone to, but I would advise that he should go to a teaching hospital, you know, where you have all the right specialists, and you'll be sent to the ophthalmology department, and you will do a new set of assessments or evaluation. Because in Nigeria, truth be told, we are at a point where, you know, a person cannot come to you with a report from another health facility and you bank your treatment based on that report. You have to run your own independent assessment, otherwise you run into trouble. Because we have issues with thorough diagnosis, we have issues with proper history taking an examination, and even reporting of investigation reports, of investigation results. So it's very, very necessary that you go to a teaching hospital, a renowned one, and then you have your eyes rechecked and reassessed. And whatever the treatment options provided for you are, you need to follow them strictly. You'll be on some eye drops, you know, to reduce the pressure in the eye, and they need to also check whether you also have other eye conditions that are coexisting with the glaucoma you have that may be worsening your vision. And most importantly, if you're having cloudy vision for any reason, I hope you have checked your blood sugar, because that is one thing a lot of people miss. So it's very necessary that you make sure that your blood sugar is also in check, because if you are diabetic, you have risk of visual disturbances as well.
Okay, so they are tied together.
Yes, so you can have diabetic retinopathy and more of cataract risk, increased risk of cataracts. Or if you are on steroid medications, you can also have an increased risk. So it's very necessary that you have a thorough assessment, complete check, so that the right treatment will be instituted.
And the same person is saying, he said, please, which of the teaching hospital can you recommend for me?
Well, I don't know where you are located, but if you're in Lagos, Luth is an excellent place. Luth and Lasut, excellent. And then you also have the FMC at Ebute Metta. Those three places, you know, they are good government institutions. Go there and you'll be able to get the help you need.
Okay. Someone is saying, my husband was having cataract after operation. He's not seeing again with his eyes, like at all.
Are you sure it was cataract he had? And if it was cataract, where was it done? And immediately you notice something is wrong after a surgery, you either go back to where you did the surgery and lay your complaints that you're not getting the recovery you expected. And if they're not able to help you there, then you go for a second opinion. In Nigeria, you go for a third opinion, even a 10th opinion, if necessary.
After a surgery?
Because or what? Or after any kind of treatment at all. Because if you are treated somewhere and you're not getting the desired response, and you know, they're not able to completely explain to you what is happening to you or what the next line of action should be, then you should seek a second opinion. Then you should go somewhere else and see another professional to get another perspective of the case, because something may be missed. An important thing may be missed, because there may be some other underlying things that are responsible. Because countless times we've seen people move from different parts of the country to the other. They've received treatment for 2 or 3 years somewhere, and there seems to be no solution, and it's almost like they've decided to live their lives like that, only for them to come to other places and they get properly diagnosed, and you know, some other things that they never knew they had before, you know, will just come out. And once you start treating them properly, you start seeing remarkable improvements, and you see the person saying, this is the first time I am seeing an improvement in 2 to 3 years, and they've been seeing some other practitioners elsewhere. So that's why it's essential that sometimes you need a second opinion. You need another professional to evaluate you and assess you.
The family has been seeking for a baby, seeking for a child, as it were, praying to God for the child. And they said they visited several hospitals, they've done several things, they've taken herbs, you know, now they are collected herbs from the village.
Of course. So I'm very happy that you raised this, because this is a big concern to a lot of couples. And we also find out that sometimes some couples have what we call primary infertility, meaning that they were never able to achieve pregnancy at all. And then you also have some people who they have primary infertility. They've never been able to achieve pregnancy at all. And then you have some people that maybe they had the first child and the first child is maybe 10 years, and ever since they were not able to have another child despite trying. So it's very important that we know that when it comes to fertility, there are the male factors and there are the female factors. In Africa, our culture and our way of life, does not really bring to the limelight the male factors, because everybody always looks at the woman as the problem. But research has shown that 40% of infertility cases is from male factors. So that's significant. So that means that it is very, very likely that a lot of the times, more than we think or more than we expect, the men need to get themselves checked. For the woman who is nearing menopause, you need to make sure that she's properly evaluated. We want to know regularity of her menstrual period. We want to know whether she has hormonal imbalance. We want to know whether she's having nipple discharge, milky nipple discharge. All those are signs of hormonal imbalance. We want to know whether she has had miscarriages in the past. We want to know whether her tubes are blocked. Her fallopian tubes are blocked. We also want to know whether she has what we call PCOS, that's the polycystic ovarian syndrome, which has to do with women having low quality eggs, and then also even if they achieve pregnancy, they are prone to recurrent miscarriages. So all those are problems, on the woman's side. So the woman must evaluate a thorough hormonal profile, including all the female hormones, the thyroid screenings. They are all very necessary. Going for all the scans, doing the HSG to know that the check for tubal patency, that the fallopian tubes are patent, because without the tubes being open, you cannot achieve fertilization. So all these are essential. A lot of women think when they have fibroids, they cannot get pregnant, but pregnancy can actually coexist with fibroids. So fibroids is not really a major thing that you say, okay, this is what is causing infertility. It can coexist with pregnancy, just that it can increase in size during pregnancy. But for the male factors, it's essential that the men should go for seminal fluid analysis. So for any couple that is having frequent unprotected sex for up to a year and you do not achieve conception, you should go for this test. So for the men, they do the seminal fluid analysis and a semen culture to know if there's any infection. What does the seminal fluid analysis show? It shows the sperm count, it shows the sperm motility, morphology, of the sperm. Because every man has some of the sperms that are a bit abnormal. They are not the actively motile form. All right, you have the sluggish ones, and then you also have the forms that look a bit deformed, but they should be a minority. All right. So for you to achieve pregnancy, you need at least a count of 20 million sperm cells per mil of the ejaculate. So that means when a man ejaculates, the volume expected is about 2 to 5 mils, about a teaspoon. And then in each meal, you should have at least 20 million. That is when you have a higher chance of achieving conception. And then secondly, the motility, you need more than 60% of it being actively motile for you to achieve conception. Then you need the morphology, the forms, the normal forms to be the majority. It should predominate to achieve.
But like I asked earlier, some persons will tell you, we've been married for 20 years. We've done almost everything, but still, my wife hasn't been able to conceive.
But the truth of the matter is, in some of these cases, like I can cite some real life scenarios where the man is never available because the man is always traveling around. Each time he travels, he doesn't come for his test. He doesn't come for his follow-up checks. When you tell the man, go for seminal fluid analysis, they're always quick to say, I'm fine. No, nothing is wrong with me. No. I don't. And my wife should just go for all the tests. So they just exclude themselves from the picture. And the fact that you have had a child before doesn't necessarily mean that your sperm quality is still the same years after while you're looking for a second child. So all those are very, very essential to know what your count is. And some of them have good counts, but the motility is poor. There are strategies we put in place, there are treatments we put in place to make sure that the motility improves. But when you are not coming for follow-ups, when you are not coming for your regular clinics, how would we know, how you're doing, and how would you pick up the medications or prescriptions that you need? So we need to have a reorientation for the men to be able to be open to going for examinations, for investigations, and then taking the necessary treatment that is required. And for some of them that have infections too, STIs, improperly treated infections or recurrent STIs too can affect fertility in both men and women. For instance, in women that have blocked tubes, the main cause of those blocked tubes are what we call pelvic inflammatory disease, which is usually from sexually transmitted infection like gonorrhea and chlamydia. And over time, you have blockage of the tubes, adhesions of the tubes, and fertility cannot be achieved. So it's very necessary that if anybody is diagnosed of any sexually transmitted infection, you follow the C's. We call them the C's. First and foremost, the first C is counseling. You're thoroughly counseled. Then secondly, you start practicing safe sex, use of condoms.
Okay.
Then thirdly, you have what we call compliance to treatment. The treatment given to you, you must complete the regimen of your treatment, and you don't stop your treatment by yourself. Then of course, fourthly, you have to do contact treatment. You know, who your spouse or whoever you come in contact with also must get treated so you don't get reinfected again. So it's very important that all these things are instituted so that you can achieve your outcome of having a baby, because it's actually complicated. There are lots of investigations to run when it comes to fertility, and it is not cheap. So you can say how your lifestyle and your health-seeking behavior, how frequently you visit the hospital, and how you have a good relationship with your doctor goes a long way to achieving your objective of having a child.
I hope we have enough time to talk about this again, maybe next week, because it's I want to elaborate on this. I want us to really elaborate on it. Let's look at the possibility of the woman having the issue. Let's analyze it from that side, and then from the side of the male. Okay, but aside that, let's go back to what we're discussing, just to answer some few questions here. Someone is saying, talking about water entering the ears is not only when, swimming, even when having my bath, water always get into my ears, and I always hit the ears to, hit out the water. So my question is, how can one avoid water entering the ears when having a bath? Okay, that's, on one hand. And the other person said, I love swimming. I stopped for a while because I had water entering, my ears, and ever since then, I have been having itching. Mm-hmm. He said, I have used some ear drops, but no result. Please, what can I do? And he said one doctor recommended one particular drug, and I have also checked some pharmacy, but was not able to get it.
Okay, like we said, water in itself, has some bacteria in it already. And you can pick up one of the bacteria called Pseudomonas from water. It's always there. So once you are swimming, it gets into your ear. You get the swimmer's itch. It's called the swimmer's itch, or otitis externa. And then the canal becomes inflamed, becomes painful. Any movement of the ear becomes very tender. So basically, if you're having this, like I said, you go to the hospital, have it examined, and then you're going to be placed on antibiotics and some painkillers to make sure that the inflammation is reduced, and over time you'll notice significant improvement because it's a form of infection, so you need antibiotics for that. If you're having any ear discharge, you may be sent for an ear swab culture, so as to identify the causative pathogen, and then you are able to treat appropriately as you should. And for the question about water entering your ear while you're having your bath, you don't need to turn your ear directly to your shower. So we know that while you're having your bath, a bit of water may get there, but you don't need a large amount of water getting into your ear. So you can minimize that, during your bath by being very conscious of that. And then when you're out, you make sure you dry your ears properly, and make sure that you may put in a towel to just make sure that as much water that is in your ear, is out. When you tilt your head, you incline it at an angle, you're able to drain one ear, and you do the same for the other ear, and to a large extent you minimize the risk of you developing ear infections from water entering into the ears.
Okay, Doc, thank you so much. We have to run now. Let's just go. Thank you so much.
Thank you
for everyone who wants to get to ask more questions or meet with you, or like I said, ask questions basically. Where do they find you again?
Can be found at Doctors Mike on Facebook. Doctors Mike, DOCTOR''S Mike MIC on Facebook. on Instagram.
Doctors Mike.
Doctors
MIC Mike, right? On Facebook.
Yes.
And Instagram.
And on Instagram, yes.
Doctors Mike still.
Doctors Mike still.
On Instagram. So everyone, if you're on Instagram, if you're on Facebook, you're free to, ask a couple of questions. Yeah. Someone was asking. I said the doctor is going round, and he's talking about almost everything, and you're a general surgeon, right? Sorry, did I say surgeon? You're a general what now? How do they call it?
General physician.
Okay, you're a general physician.
Absolutely.
Sorry, I said surgeon.
Yeah.
You're a general physician.
Yes, I am.
But some persons will be surprised. They see doctor, they go around like that.
Well, it's just good for you to be vast, in what you do. And absolutely, we still make referrals. So we are like a central point to making referrals to other specialties. So if you come to me with a skin condition, once we've managed you and there are still a bit of hiccups, you go straight to the dermatologist. If you need a surgery, refer you to the general surgeon. If you need eye check, you go to the ophthalmologist. If you need to see the cardiologist, you go to the cardiologist or the gynecologist, as the case may be. But overall, we have a very good knowledge of all the specialties. We're able to give you the best advice you need in a timely fashion, because that's what matters. Anytime something comes up, you're able to get the information you need, and the information would help you make the right decision.
I want to be like you when I grow up. Now that's the way you read. That's the way you read. Now I won't read.
But you're already grown now.
It's just that I never grow. I never get some teeth see the inside. I never get it.
Some teeth never come
finish.
out.
That's the way you read. I won't read now. Tomorrow morning I'll start.
No wahala
Yeah. Everyone, I want to say thank you so much. Thank you. Someone is still sending questions again. Jude, please ask the doctor for NGO for kidney patients, please. Okay, then. Just go to Doctor's Mike on Facebook or Instagram, okay? There, he is going to meet. If you want to meet him, you can just meet him there. Ask him questions. For now, it's there's no time.
YouTube.
Oh, YouTube. Okay, YouTube too, right? What's it on YouTube?
Same.
Okay, Doctor's Mike on YouTube, right? Beautiful. Doctor's Mike, YouTube, everywhere. Doctors, apostrophe S, then Mike, M-I-C, okay? And he would answer all of your questions there. Thank you so much, Doc. Couple of questions still coming in, but I've told you where to go to. Thank you. My name is Jude. Ikami Jude. It's time to go, okay? On Facebook, Instagram, YouTube, TikTok. Which other one again? All of them. I am. Yes, I am IKAMIJUDEH. IKAMIJUDEH. That is Ikami Jude. I'll see you again tomorrow, 7 a.m. Good morning to you.